coming at you on my pre-op day. Tomorrow is surgery, July 13th, 2016 at 9:30 a.m. So let's get into it. So I am 35 years old. I'm 5'6". I'm 200 and I'm just going to put it out there because I think I've gained a little weight this week. I think I'm 200. I stepped on the scale this morning. I think I'm 232 pounds. But it also depends on what I step on the scale at tomorrow. Last week when I went to my pre-op diet, my pre-op appointment, I was 227 at the doctor's office, but then again, I hadn't eaten anything all day, and the appointment wasn't until I think 2 o'clock in the afternoon. And then when I went over to pre-op to see the anesthesiologist, I was 229. So I'm fluctuating around the same amount that I've been fluctuating. So there's been no weight loss since starting this entire journey. And I don't care because the highest recorded weight that I've ever been was 260 pounds. And that was when I was pregnant. So that's the most I ever got. And then I just dropped from there. And I've just been hovering around this particular because I was already 200 pounds before I got pregnant with my kids. And I think in my adult life, the lowest I ever got was like 180, 175, something like that. So I've never been in the 150, 140 area in my adult life. So my surgery is tomorrow. It's with Dr. John Daly at Northside Hospital in Atlanta, Georgia. I am a self-pay patient. And so a little bit I'm freaking out, but I'm also, very excited. I know I've seen a lot of people, make it through surgery and they're doing very, very well. And so I have that same optimism. I am going to make it through surgery. I'm going to do well. And I'm going to come out of this on the backside and just do well. So the biggest thing is today is my pre-op day. Clear liquids. No purple, no orange, but I can drink some protein shakes. So I have been doing some Premier Protein. The biggest thing about Premier Protein, I don't know if you guys have had this problem, but I tried to drink a vanilla one. I don't really like the vanilla ones, but because I have them, I'm going to drink them. And I have put them in the refrigerator, and the one that I pulled out had curdled. It tasted awful. So I don't know if it was just that one or if it is the whole case. So I'm going to contact the company I ordered them from and let them know, this is unacceptable. My chocolate hasn't done that, and the strawberries and cream hasn't done that, but it was just the vanilla, and so very gross. So that's what I'm doing today, is drinking protein shakes and drinking water and hanging out, vegging out. I'm going to be a nerd. I'm going to play video games when I'm done talking to you guys. Because, that's what we do. And then what else? Yeah, that's pretty much it. Because my surgery is in Atlanta, we have to get up at 5 in the morning to be out of the house by 5:30. I go to work and I have to be at work at 6:40. So I leave the house at 6, and the hospital I work at is maybe 15 minutes away, and 10 to 15 minutes away. And at 6 o'clock in the morning, it takes me a good 20 minutes to get there, 20 to 30 minutes sometimes, depending on if there's an accident, to get there because Atlanta traffic is awful. And so and we have to go further this time. We have to go into the, it's pretty much in Atlanta. So we have to go, I think it's normal travel time is 35 40 minutes, and so it may take an hour, it may take an hour and a half, we don't know. So you have to excuse the hair. I got in the shower and I got out and I was like, I'm not doing my hair, I'm not putting makeup on, I'm not gonna do, excuse me, I'm not going to put on makeup like I did last time. Like I'm just vegging out. I worked yesterday. Um, and this is the first day that I've had off of my 4 week vacation. And I just don't I don't want to I didn't want to I don't want to go movie. I really don't want to go to the pool. So we're just going to play video games. And I'm going to drink my proteins and I'm going to drink my water and my soups and um, my popsicles and my jello and be content. I mean, it's pretty awful like looking right now, so whatever. I don't care. But excuse me, let me get some. But anyway, so that's what I'm doing now. I am partially packed, I think. I'm pretty much packed. I've packed my bag and I've got like Gas X strips and I've got Cepacol throat lozenges and I've got some Biotine throat lozenges to help with the dry mouth. And then my chapstick and my my robe, my slippers, my some couple outfits to change into, and some underwear for sure. I may have to pack a couple more just in case. Um, what else? My vitamins and my medications. You know, the typical stuff: deodorant, lotion, toothbrush, toothpaste, stuff like that. I'm gonna take a pillow and my laptop, my phone, the chargers, um, my headphones, stuff like that, earplugs, my eye mask. Um, so those are the those are some of the things that I'm taking. I don't know what else I need to take. If there's anything that you guys know that you took that was very helpful and I didn't mention it, just let me know because just because I'm a nurse doesn't mean that I know the other aspect. I know every single aspect of medicine. Yes, I take care of laparoscopic surgery patients afterwards, but to be on the other end of it is completely different. Um, to actually have surgery myself when I've never had surgery ever, uh, to know what to take to the hospital, I have no idea. I give my patients pain medication after their surgeries, but I've never experienced that pain, so I have no idea. So this is going to be a learning experience for me, for learning that experience for my patients, knowing that this is how I felt, so I know exactly how you're feeling. Um, and of course, like I've always known that yes, pain is subjective, but the thing is everybody has a different pain threshold, and you can feel pain differently than somebody else. And for me, I have a high tolerance for pain. I mean, you could practically like chop my arm off, and the pain wouldn't be like super super crazy. But then again, you never know. Like I gave birth to my two kids naturally, and I did it without epidural, and I had maybe a couple injections of IV pain medication, and that was it. So I have a high pain tolerance, and for me, it wasn't like it was super painful. It was just a burning sensation. For those of you that have had kids, um, but it's one of those things. You don't know what type of pain you're gonna be in until you experience it. So, um, but like I said, if there's anything that I didn't mention already, it would be helpful for me to know if there's something that I need to take that was helpful for you guys. So, to wrap this up, I want to say I'm having brain farts as I'm speaking. Um, I want to thank everybody that has subscribed. I want to thank you for watching, for encouraging, all the encouragements for encouraging me to on this community. It has been, I mean, I watch, you know, I watch the videos, and on some of them, yes, I do comment. I don't always comment, um, but I feel like this community is so supportive, and I've felt supported throughout the community, and it has been very helpful for me, and it will continue to be helpful to me. And so, as I make my way through my journey, it will be interesting to watch how I change and to see how everybody else changes as well. So it is very exciting to be able to be here at this moment, and to be here um, almost to the point of to getting there. I am going to sign off now. I'm just rambling at this point, but thank you to all of you who have subscribed and who have supported me. So today is it. Tomorrow is going to be the beginning of the rest of my life, where I am going to change for the better. So I will talk to you guys soon. I'll probably post a little video once I'm like coherent enough to post, to make a video. I will post one that I made it through surgery. So keep me in your thoughts, and I will let you know. Okay. I will talk to you guys later. Thank you so much. Bye.